they become a community climate that's receptive to the idea of evidence-based practice. And my sort of favorite example right now is the Stevens County Mental Health Center. Now, I've never really been all that clear where Stevens County actually is, but it is in eastern Washington for sure, and it's like north of Spokane. And they participated in the TFCBT initiative, and they have this fantastic supervisor there, Leslie Mann, who does the cases herself, supervises her people, gets on our call once a month for consultants, is always sort of interested in trying to get access to new stuff. And because their experience was so meaningful with regard to the TFCBT, they decided they were going to adopt PCIT. And they are not only adopting PCIT, but they're participating in a randomized trial funded by the CDC to disseminate PCIT in routine settings. That were funded to the University of Oklahoma, where they are big inventors of PCIT. But this is a test of ways to train therapists, as opposed to the intervention itself. We already know the intervention actually works, but the trick is, how are you going to get people to do it, and what is the best method for that? So this study is randomizing, and it's a sort of a complicated design, but basically telephone supervision, case supervision to clinicians, versus live remote coaching. Since PDIT is an intervention that's delivered through coaching the parent with a bug in the ear, it lends itself to a methodology of telemedicine. So an expert therapist can coach the novice therapist while they're coaching the parent using a Polycom. Now, talk about technological problems. Let me tell you, that's been the biggest problem with this study. Is you really actually have to have DSL for that to work. And it turns out most social workers really don't know how to plug things in or turn switches. In fact, our RA has realized that that's an expectation of her job, is she's supposed to be a technical wizard and know how to set up the Polycom and the this and the that. And there's a lot of sad things where people in their settings are trying to do this, where the therapists are like in the hallway looking at monitors to see the people around the corner. And I got to tell you, that doesn't work perfectly. But now we have Stevens County, where, what a deal. They're right in the middle of it. They got the Polycom, well, we did get the Polycom hooked up, and they're now able to do live remote coaching for their therapists. Now, what could be a cooler deal in terms of dissemination that in Stevens County, Washington, the children in that community can go into the local mental health center in Colville, and they can get TFCBT, or they can get PCIT. Who knew that is something that people would not only could happen, but that people want that. So I don't think our problem in the evidence-based practice world is anymore this business of having to talk people into why they ought to accept our evidence that this is a preferable way to go. I'm not sure that's the best strategy to get people to do it, this piling up the evidence business. I haven't found that really flies for the average clinician to say we have another study that's published in a really famous journal that proves we're right. I've seen that happen for years at the International Society for Traumatic Stress Studies, because Edna Foa, who is really basically a genius, but she's pretty much the I don't understand why you don't believe the evidence person. And she's stacking up higher and higher and higher the studies showing that prolonged exposure works for traumatized individuals. But that's actually not been at all, I think, the thing that has turned the tide for clinicians and practitioners. It's been more the real life experiences that people have. And I think we need to think about how to bring that part of the conversation more to the teaching experience. I can tell you one place I really was impressed by this, and if you haven't seen this website, this that's Jürgen Munitzer's website for the intervention he invented called Impacts, which is a brief CBT for depression, and which works. But what I find unbelievable, where he's onto, kind of a strategy for this that I think more of us need to get onto, is if you go to his website, there's a whole section on testimonials that of people, real life people talking about the real life differences in their life as a result of getting this brief. I think it's only 8 sessions or something like that. Pardon? Jürgen Unitzer. He's in the Department of Psychiatry, and Impact is the name of the intervention. You can Google it and go to the website. But it's not just the testimonials. You can get everything you need. He's got the evidence there. You can get all the citations. You can download the articles if you so care. You can get the measures that are used to evaluate whether people are getting better. You can just download that. You can get the manual. You can find out everywhere where people have been trained in it. I want that. I'm thinking, like, Eric, could we have that? A website that makes it easy for people to learn about an intervention and get everything they need. It's a really neat strategy. And this business of people taking up evidence-based practice in real-life settings, which is going on, and our state actually is known for doing this from a public policy perspective. We in the public mental health, child public mental health side, we're coming on the heels of the Juvenile Rehabilitation Administration in our state, which has been way out there on this long before we got into it, and who took a strategy to promote several evidence-based interventions that have been shown to reduce recidivism, because really that's all they care about in the juvenile justice system, and that's probably all they should care about, or it's the main thing they should care about, because that's the evidence that something is working or making a difference, is if fewer kids are committing more subsequent crimes. But we have, the Washington State Institute for Public Policy that's published numerous reports documenting that the use of these evidence-based interventions like MST, FFT, FIT, and Do-Re-Mi are actually changing our juvenile justice system. And one of the things that I think is an amazing thing to see happen, and to see how taking an evidence-based approach and really doing it and really getting results in the real world, is that it can actually influence public policy in a very significant degree.